Sometimes it feels like the sun will never rise, like the birds will never sing again. Believe in a power greater than what you are going through. When you don't know what to do, keep breathing.
That's right. When you don't know what to do, just keep on breathing. From the City of Angels in Los Angeles, welcome to all my listeners out there in Radio Land. I'm Dave, the Caregiver's Caregiver, at caregiverdave.com, along with my lovely co-host, former mayor of a California beach town and best-selling author, Debbie Peterson. And we're also coming to you live and on demand 24/7 on numerous syndicated radio and podcast networks on 30 global audio and video platforms like iHeartRadio, iTunes, YouTube, Spreaker, SoundCloud, Vimeo, Stitcher Radio, and a whole bunch more. In fact, we're proud to be voted #1 caregiver podcast on FeedSpot out of thousands and #1 podcast of the top 50 on Player FM. And we have an especially exciting show planned for you today. Toni King has been more than 20 years experience as a top sales leader in Medicare planning. When Toni saw the recurring theme of confusion as it relates to understanding the rules of Medicare for choosing which type of Medicare plan that would best suit the needs of the average American, she was inspired to write the book Medicare Survival Guide, much needed book. Toni King is an accomplished Medicare advocate, author, talk show personality, public speaker, national newspaper columnist. She also presents Confused About Medicare workshops throughout the U.S., helping thousands navigate what so many consider to be the maze of Medicare. And this is going to be a great show. We're going to take a whole hour to go through this because there's just way too much to talk about. Well, hang in there. And just want to take this time to thank my last week's guest, family of 5, the Stanberries, wrote their first family memoir in the autumn of 2024. Never too late, sometime. And just a reminder, you can watch or listen to that interview and all our interviews, including this one, on our membership website, caregiverdave.com, or any of our other 30 global audio and video platforms that I mentioned earlier. All right, enough of that. Toni, so great to have you finally on the Caregiver Dave show. You were sick one time around Christmas time, and so better late than never.
It's been an adventure.
Yeah. Medicare is an adventure too, isn't it?
I don't think they really knew what it was going to be like when they made it in 1965. So
we'll see what Elon Musk and Donald Trump can do for it. I always like to ask my guests, just who is Toni King and why is she placed on this earth?
Why was I placed on this earth? I found that out about, I would say, July of 2007, when a gentleman came into a workshop and got the wrong information from Social Security.
Imagine that.
I told you about that today. He told him that he had company insurance when he had retirement benefits.
Really?
And the Social Security rep told him to sign the back of his Medicare card and send it back in so he could delay his Part B. He didn't want to have to pay his Part B premium. He was in what they call his initial enrollment period. He went in the next month, got a stent put in his heart, and owed over $10,000 because his Cigna health insurance did not pay. He used the wrong wording. He should have said, I'm on retirement benefits, not I'm on company benefits. I knew the answer, and I took the Medicare New Handbook and put it in people terms and wrote my first book, The Maze of Medicare. Medicare Survival Guide. And
I bet you have a lot of terrible stories like that.
Oh, I helped a gentleman that put Neil Armstrong on the moon navigate how to enroll in Medicare. I can help you with your situations. You've got there's more to this than buying a plan.
Yep.
So you've got to understand how Medicare works, what you can do, what you can't do. And you've got to realize that you are a walking dollar sign.
Yeah, really.
She likes it. Debbie likes it.
Yeah, I've already got questions for you.
Okay, but that's what everybody needs to realize, that they are nothing more than a walking dollar sign. And the call centers are all over the world calling us. There's 65 million people on Medicare. There's about 12,000 turning 65 every day.
Oh my goodness.
Not a month, a day for the next 10 plus years.
Well, I agree with you. First of all, getting them to answer the phone is amazing. And then you don't know if you're going to get right information or not. There's a high probability you get wrong information. And Trump just said he's going to, cut all the phone service budget and this and that. Everyone's saying, well, no, then what the service sucks already. Why are we paying? Maybe there's a better alternative. I don't know. But we'll try to keep politics out of this discussion.
Yeah, because politics doesn't make a difference with this. I don't care if you're Republican or Democrat, gay or straight, what your nationality is. Medicare affects everybody the same way.
Right. And, all my life, I'm 71 now, I truly believed that Medicare would be broke by the time I turned 65. And now, I waited until I was 70 to get to my maximum. And I've got a pretty good number coming in, about 3,900, which they say is good.
That's Social Security. That's not
Social Security. Yes, that's right. And then I started getting Medicare at 65, I believe. And because I'm in a higher tax bracket, I was shocked to find out that they want to charge me more for my Medicare than anybody else. And so they were tacking on another $250 a month, and depending on what my IRS 1040 form said. Sometimes it goes up, sometimes it goes down. And I guess that's called a wealth tax. I don't know. But I'm thinking
that's called Maggie and Irma. Medicare has 3 family members. Debbie's going to like this. They have 3 family members, and you have 2 girlfriends with Medicare. Okay? The 3 family members are the IRS, Social Security, and Medicare. The IRS is like the stepmother out of Cinderella. She tells them everything that's going on with us. And I have helped people that I had one gentleman come in the office who made over $900,000 a year working for Wells Fargo. I helped him bring his income down. So his Part B was the average premium. You have to know how to navigate Social Security. There's more to this than buying a product.
How do you bring income down?
Well, we have to make that another workshop.
All right.
We have to make that another talk, because that's confusing people. But there is ways that you can do that. If you're retiring and you're no longer working, when you quit working, I can bring yours down. I promise you.
Well, I can ask you a simpler question for normal people. I keep seeing these ads on television, and they say, oh, if you get Medicare and Medicaid or Medi-Cal in California, you can also get, all kinds of things. Free gym, you can get a card that'll give you free over-the-counter meds. Are those real? I never call them, but are they real, or are they?
Do you have to be an illegal alien first?
No, you don't have to be. Okay. You can't be an illegal alien. You have to have Medicare. There's certain rules to Medicare. Okay. You have to work 10 years or 40 quarters and pay into the Social Security system. They haven't changed the rules towards people that aren't working. I don't believe. Okay. They haven't changed those yet. But if you're what Debbie's mainly talking about is Medicare Advantage plans.
That's it.
California has their own different situation. Medicare has 4 parts. You got Part A, you got Part B, which is original Medicare. That got started July 30th, 1965, when LBJ flew to Independence, Missouri, and signed Medicare law in front of Harry Truman. The cost of Medicare was like $40 a year. That was that's, the premium. What you're paying right now was $3 when Medicare got started. That was it. So it's changed over the time. Everything's changed. I mean, they didn't have prescriptions for cancer and prescriptions for Parkinson's and prescriptions for all the different health issues that we have today. So everything's grown. That's how it got started. And now today you have Part A and Part B. Medicare Advantage plans got started about 2007 is when they got started. That's Part C. And then you've got prescription drugs, which is Part D. So all the ads that you're seeing about the freebies are for Medicare Advantage plans.
What's Part G?
That's a Medicare supplement that goes with
Okay.
Part A and that goes with original Medicare.
Pay
That's
the deductibles.
So that's another workshop in itself. So there's all sorts of different parts of Medicare.
Well, the average price of caregivers is the average price. The average age of caregivers somewhere between 35 and 55. So the average caregiver isn't on Medicare yet. But why don't you talk to them first? Let them know what they should be doing, how they should be preparing, income. What do they want to do with their social
their family member?
Income? Yeah.
What an adult child needs to do to help their mom or their whatever they can call us on our number, on my phone number, or they can email me for specific questions because each person's situation is different. I can give you just an idea.
Yeah.
But if someone is trying to get their mother some care, then, you've got to look at income. You got to look at what state you're in. However that goes, is your mom in a Medicare Advantage plan? What's the situation? Some of it you may have to pay to have that caregiver come to the house.
Yeah.
I've had that happen with my mother, but we were lucky that my dad was a veteran from Korean War, and you have veteran benefits that can help. So there was like $1,500 that helped out with the VA benefits. So there's different, you've got to look at each person. You got to customize it and make it meet your needs, not the needs of the person that's calling you over the phone. People need to realize that when they get a phone call and you don't know who that person is, hang the phone up.
I know, and I hang the phone up all the time because they have a key question. Did you get your new Medicare card yet? And I say no, and I hang up because they're trying to sell me something.
Well, how about, did you get your plastic Medicare card? There is no plastic Medicare card.
Yeah.
So people need to realize that. And
what are they selling? Are they selling Advantage plans?
They're selling whatever you will buy.
I see.
And some of them aren't even selling anything. Some of them are trying to get your Social Security number, or trying to get your Medicare number, and then they can charge for COVID vaccines, or they can charge for whatever on Medicare, and they get paid. And I got 2 packages one day from my special needs sister of COVID shots.
Yeah.
I don't know how they ever got
here. So
word
to the wise, anyone who gets a phone call from anybody claiming to be Social Security, hang up, because they don't call you, right?
They will not call you. Social Security, the IRS, Medicare, Medicaid will not call you.
And if they ask you if you got your new card, just hang up.
That's
and then block their number.
Yeah, and block their number. But then they'll call on a different number.
If you know how to block their number. Some of these that are older don't know how to do that.
I know, and
they need to know what to do.
And I know so many people who would be so defrauded by these calls and these emails. It's like, oh my gosh, no wonder why they do it, because their audience is ready, willing, and able to give them whatever they want.
Yeah.
So if we go back to my original question, because we're kind of dealing with 2 sets of people. We're dealing with the 35 to 65-year-old caregivers, and then we're dealing with the people they give care for. But if we go back to my original question, if you see these ads on TV, call this number, Medicare Advantage, and you'll get, we'll give you the world.
Free Medicare.
Are you saying don't call them?
If you're looking into it, you can give them a phone call and talk to them and find out what it is that you need, that you want, but always have somebody there with you while you're talking to somebody. Okay. And the other thing you do is always talk to your doctor before you make a change. What if you make a change and you're in the middle of cancer treatment and you change and that doctor is no longer involved with that Medicare Advantage plan? I mean, there is nothing any better than original Medicare, which is Part A and Part B and a Medicare supplement.
You get to choose your own doctor and your own hospital. And
anywhere nationwide.
Yeah.
That's
the way to go. It's been tempting to go to an Advantage plan. I never did it because my wife always says, no, I like my doctors. And so as I got older and I started seeing more and more doctors, I says, yeah, I don't want to change doctors.
Yeah. But if something happened and you got some kind of cancer situation, and they sent you to MD Anderson down here in Texas, all you got to do is pick up the phone and make an appointment.
Yeah.
Okay. You don't have to look and see what network you're in. And that's what the kids need to understand. Because they
want the best doctor, not the
company insurance.
Yeah.
They have no idea of what all's going on.
It's probably the cheapest plan and you get what you pay for. That's what I found.
Well, you may have a zero premium. You pay nothing.
Yeah.
But your maximum out of pocket could be $12,000 out of network if that doctor accepts a plan. So you can always go to an Advantage plan. That's what October 15th through December 7th is all about. You know, when Joe Namath and all the guys are doing their ads, that's Medicare's open enrollment. You know,
I have a question on that out of network. I actually have that problem because I work with a lot of I go to a lot of specialists, and they don't even take insurance. Now they'll give me the invoice or the the receipt, whatever I need to turn in, but I just never have the gumption to get it all turned in. Can you actually get reimbursed on some of those?
Yes, ma'am, you sure can. If your doctor is not accepting Medicare, all you have to do is file the claim with Medicare, and they'll pay you what the Medicare amount would be. Great. So, Debbie, you need to call me.
You might still have
I'm calling you.
And
what's your phone number if people need to call you?
Well, I'm not one of these 800 number people. My number is 832-519-8664. That's just a voicemail. And you can leave your message.
And we'll do that again. 519. Do that again at the end of the show too.
Yeah, 832-519-8664. And my website is Toni, ToniSays.com. I'm Toni with an I and not a Y because I'm a girl.
Can you say that again, Toni?
ToniSays.com. That's my website.
Toni Says. Okay.
Toni Says, because what Toni says matters.
Sure does.
I did not ever realize that was going to take off, but it has taken off like crazy.
And well, I think you do need it's almost like you need a degree in rocket science to understand all of this. And I know Dave's smart. I know I'm smart, but heck, I can't figure this stuff out.
I know. So how do you get paid? How do you make money, Toni? Just by selling the plans? Because you get free advice?
There's two different options. Number one, I do charge a consultation fee. It depends on what the person's situation is. If I have someone come into me that is on Medicaid and they're having a hard time with life, I'm not going to charge them anything. Because they need help. I'm an American. People come first. You've got to help people. It's going to come back to you. Right. But I charge a consultation fee. Someone comes in and they're leaving work and they want to know, how do I get on Medicare? What do I need to do? Your rule in California is the same as my rule in Texas, and it's the same as the rule in New York or Florida. You've got to have your company sign forms so you don't get that Part B penalty. Like I said, Medicare has 3 family members and 2 girlfriends. Well, the 2 girlfriends are Maggie and Irma. Those are the ones that you're dating right now, Dave. You're dating Maggie and Irma, the modified adjusted gross income, which is your income, and the income related monthly adjusted amount. So I know how to look at it. Now the person's not working. What do? Well, you can file forms with the Social Security office. So we go through a lot to help people. It's not just, here's your plan, go buy this Medicare supplement, you'll be fine. I don't want you to have to pay the $600 or $700 because your Part B premium is more than what it should be. You got B and you got D that you have to pay extra for D. Because
that's one I've never understood, because my accountant last year, I had a pretty good year, and he said, hey, you're going to get more Social Security because you had a good year. And I thought it was sort of fixed. I don't understand that. How does that work?
That part I don't know. You'd have to talk to your CPA.
Because you're paying more Social Security. You're paying more Social Security taxes. That's what he means.
Yeah. No, he said I would get more Social Security income because my income was higher.
I don't know.
When your income is higher, you pay more FICA.
Yeah.
When you pay more FICA, you get more when you retire, because it's like adding to the account.
Yeah, we're going down. That's another. I mean, you got to divide this up into different types of.
I'm retired now, so I don't work anymore. My only income is from an annuity and from Social Security. And man, they taxed me 85% of my Social Security. I'm so grateful that Trump is going to make it tax-free.
Okay.
Fingers crossed.
We hope and believe that will happen, because
you can get them on the
promises made, promises kept, right?
We don't know how long it's going to take. Whenever they make changes towards Medicare, it takes 2 or 3 years to make that. Why it takes so long, I don't know. They say right now the Social Security office is a wreck. Well, it's been a wreck for a long time. It's been a wreck since COVID.
So the word retroactive is not in their vocabulary.
Yeah. So I mean, things that you just got to learn how to work the system. I tell people to go in and see that Social Security agent face to face, so you know who to write the name down and go back and see them to make sure that everything's done properly.
You recommend going down to the office instead of calling, right?
You're not, because the person you're calling can't give you the answer. They're only going to answer what you give them, what question you give them.
And the people who work at Social Security aren't answering the phones, right? You said some people in different countries.
Do what?
You said different people in different countries answer the phone.
Not for Social Security, I don't believe. No. Not yet. Not yet. Let's give it another couple other presidents before we go there. Okay? I think that's what you got to do.
One of the things I did when I was first starting into this was I saw that there was a free number that you could call and find people who volunteered to help with this kind of stuff. And I have very complicated, I have to take a lot of medications that are expensive. And so I have Medicare Part D also, but there's really only 1 or 2 policies that will cover all the medications I need. Is that something that you can help people find, someone who can look at it every year and give them some advice?
Medicare changed this year. This is the one good thing that Biden did. He changed the Medicare Part D, where you used to have to pay more. And once you paid a certain amount, everything was kind of picked up at no cost. You had more out of pocket. Now this year, your maximum out of pocket is, you shouldn't have to pay more than $2,000. And whoever did your Part D planning should have gone online to should have gone online to Medicare.gov and seen which plan would have been best done you the right way.
And that's what I do every year. There's a group of volunteers locally that the state actually gave me their number, and they look at my situation every year and help, and they go online to the medications and all that stuff, and they figure out which is the best, the least expensive program for me.
So if you've got a higher amount, your maximum out of pocket for this year should be $2,000. That's it.
That's correct. Yeah.
And then after that, you're not going to pay anything but what your premium is. Mm-hmm. Whatever your Part D premium is, and your IRMA, because you're making a lot of money.
And these volunteers don't sell insurance, right? They're not.
No, they don't. They just
Yeah.
evaluate it and tell you the
Right.
best one. Yeah, they're
Give me their
wonderful.
number too.
I'll see if I can find that for you.
All right.
I deal with someone local now because it's county by county in California.
Sure.
Yeah.
Yeah, it should be done through the state. I
I
mean,
think maybe the state subsidizes them, but there is a free service in California to help you figure that out. And I was so grateful for that because I didn't want to call somebody who sells insurance.
no, because they're going to try to upsell you. We don't try to upsell you, but sometimes it takes a lot of time to do it.
Yeah. Let's talk about
Yes,
your
it
book. I'm
does.
sure you wrote it very thoughtfully. What's in the first chapter? What's the first thing you talk about in your book?
How to enroll in Medicare, the different parts of Medicare, how do you need to enroll?
Is it easy?
I've got my little picture of LBJ signing Medicare into law. But the first chapter is pretty much how to enroll in Medicare the right way.
Mm-hmm. Because you can do it the wrong way.
Well, are you turning 65 and not working?
Hmm.
Are you turning 65 and still working? Maybe you've got you're self-employed. Or do you still have company insurance? You know, people sign up for Part B and they've got company insurance. Then when they leave that company insurance, they've been paying that Part B premium all this time. Sometimes you don't need to do that. You can wait and get that Part B at a later date. Because if you've got Part B longer than 6 months, then you got to answer, you're finding that out. You got to answer health questions for your Medicare supplement.
Right.
You know, so you got to be real careful with what you do. I mean, there's 65 million people on Medicare. Come on. They're being
So I've got another question. Another question on that. I was in a car accident and couldn't work for a couple of years, and I wasn't even 60 yet at that point, and I was looking at, well, maybe I should get disability. But then somebody said to me, if you get disability now, it's going to really hurt your Medicare payments later. I don't know if that's a question you can answer, but I suspect that a lot of caregivers are dealing with people on disability or who need who may have a choice to make there.
Well, you got to look at the person's situation that the caregiver is taking care of. You know, that's my article that I emailed to Dave earlier about how to qualify for Medicaid if you're not making a lot of money. If you get on Medicaid and you meet it financially, you don't want to sign up for Social Security disability because that's going to be more money than your Medicaid and you'll lose your health care that the state's paying for.
I think that was, that was the issue.
You know, so that's very confusing. I don't know if you looked at the email that I sent you, Dave.
I haven't seen it yet.
I sent you two.
I did not look.
Okay, well, you'll have to.
Let's explain parts A, parts B, C, and D. Did you do that already?
No, I hadn't done that yet because you hadn't asked me. Okay, part A is your inpatient hospital. That's all that is going in the hospital. And right now the deductible for Part A is $1,600, and I believe it's, hold on, I got the numbers right here. $1,600 and like for Part A, it's $1,676.
Did that go up?
It goes up every year. So for this year, it is $1,676, not once a year, but 6 times. So every time you go in the hospital and you have an inpatient hospital stay, that's what your Part A is. I have not experienced Part A. You may not have experienced Part A. Everything I've done has been Part B. And then it covers your skilled nursing, your hospice, and your home health. So
when does the deductible come into play?
When does the deductible under Part B?
No, Part A. You said there's a deductible.
The deductible is when you go in you go in and you stay in the hospital. You have an inpatient hospital stay.
So it's per stay, not per year.
Per stay. So if you take 1676 and multiply that times 6, that's what the deductible is. Remember, that started at like $40. So
Why are you dividing by 6?
it's 6 times. You have a deductible of inpatient hospital stays 6 times a year.
Well, maximum of 1,600 or whatever.
Yeah, whatever.
So every time you go in the hospital, you have a deductible of 1676, and you can do that 6 times a year, so that multiplies out to.
Yeah, and not very many people really ever hit that.
But they don't take the whole 16. They just take 1/6.
They just take 1,676. It's each time you go in, it's 6 times. But sometimes you don't have that inpatient hospital stay. And you have to be in the hospital fully admitted for 3 full days with the 4th day discharged to get skilled nursing. The first 2 days that you're ever in the hospital, you're as an outpatient. They've changed all these rules. They're all in the Medicare, your Medicare and You handbook. Am I an inpatient or am I an outpatient? The first time you get on Medicare, you are an outpatient if you're going in the hospital. And you has to have a 2-day stay. Then you become an inpatient. I mean, they knew how to work it so they can get it. So we have to pay more money. All right. And then after you've had your stay, then you go into skilled nursing. And you've got roughly 100 days of skilled nursing at no cost. But most of the time, people only get 20 days. They try to get you out as fast as possible. And then you have hospice, which
I'm sorry, let's go back to 20 days. It's 100% the first 21 days, and then it's 80% after that, up to 100 days.
You've got 100 days.
But there's a higher deductible after 21.
The deductible of what Part A, the skilled nursing is. So you've got, it's like $209 that you have to pay days 21 through 100.
Yeah.
But you don't want to get caught up on that, because if you're on a Medicare supplement or you're on a Medicare Advantage plan, you're never going to see these numbers.
Well, the problem is my wife's on a Medicare supplement, only Plan A for some reason, and they won't give her Plan G. I'm fighting through underwriting to get her on Plan G. It should have been done when she got the policy, but I didn't know.
Well, we'd have to look at her Plan A and see what all it is that it's covering. Whoever sold her something did not do a good job. They shouldn't have put her on Plan A.
All right.
You got Part A, but she's on Plan A. So now we've got people that are listening to this podcast. They just fainted.
Yeah.
Okay. And then you've got, the reason why I wanted to get to hospice is my mother had a Medicare Advantage plan. And when she got on hospice, her hospice automatically went back to original Medicare Part A. And she was we were able to get a hospice nurse to come to the house. Or when I put her in a skilled nursing facility, or I put her in a personal care home, they were able to visit her, and she had a Medicare Advantage plan and paid absolutely zero. So you've got, once someone gets sick, and that's what you work with as caregivers, people need to know what to do and how to take care of their person.
Yes.
What's the best way to meet their needs?
And for us, how to help the caregivers have a bit of a break and have a life and stay healthy. So
I think just having your phone number is going to be a big help.
And
you do answer the phone, right?
I do talk a whole bunch.
Let's give out the phone number again, because people may be coming in and out of this podcast. It's 832-519-8664, and they leave a message and you will call them back. Is that
correct?
Right?
Somebody from my team will call them back. Or they can email us at info at Toni says, TONI says.com. And I'm sure you put this when you're sending it out, maybe you put these numbers down.
Mm-hmm.
So, yeah, they can always email us, or they can, or look on my website and go
All
on
right.
it. And
So how far did you get? A, B, C, D.
we got to A. We only got to A. Okay. And A covers home health. Okay. B is what everything is. And right now, the deductible for Part B is $257. So that's my out of pocket. That's your out of pocket, Dave.
Doctor visits and stuff.
Yeah. So once I hit the 257, I don't pay another penny for the rest of the year.
And that's on doctor visits, lab tests, all that kind of stuff.
Last year, I was ambulance when I was supposed to be on your show, and I told you that I had the flu, or something just brought me down like crazy. And I was so weak, I couldn't drive myself to the doctor. I had an ambulance come pick me up and take me to the emergency room.
Did they pay for it?
100%. I hadn't paid a penny.
You're on Advantage or no?
Do what?
Are you on an Advantage plan or no?
No, I'm on a Medicare supplement. Okay. And I just got my bill with my Medicare supplement for next year, and I've gone up $2.
How much is it, if you don't mind me asking?
Well, since I'm going to turn, I cannot believe this, May 20th, I will be the big 70. So you're a year older than me, and I'm paying $115 a month for my Medicare supplement in Texas.
I'm paying a couple of hundred. I'm 71. It did go up $10. So
yeah, but you're in California.
Yeah,
it costs a whole bunch in California. It just depends.
Sure does.
Well, I've got that. Be worse. Yeah. My brother tells me that his is over 700 for he and his wife. So I guess it could be worse.
Where's he live?
You could be richer.
It's $350 a piece if they're, in a
certain tax bracket. Yeah.
For $350 a piece, they're out of pockets $257 with every hospital and doctor nationwide.
That's pretty cheap. You can't get insurance at that price.
No, you can't get an individual plan. So you can't
not at that age.
Nothing. Yeah. So that's and with Part B of Medicare, it covers everything. That's where you're going to go for your cataract surgery and all of that.
Now, what about some of those additional things that people need more maybe as they get older, chiropractic and acupuncture and even counseling or, psychotherapy, mental health therapy? Is any of that available on any of this?
It's all available under Medicare, but you have to make sure that who you're using will file it with Medicare.
A lot of them don't want to do it.
Some of it, they may not pay as much as you want them to pay.
And if they don't file it, you can still pay it and then file it yourself and get the Medicare
reimbursement for what Medicare is. Now, I'm not too sure about the acupuncture, chiropractor, as long as it's medically necessary. What you see as far as Advantage plans, I would look at the doctors and find out who they're really using. That's Part C of Medicare. So we talked about A, we talked about B. Part C is your Medicare Advantage plans. That's your HMO or your PPOs. That's all that you're seeing right now. Right now is the tail end of Medicare Advantage, but in October it'll start back up because they're going to get ready for next year.
You recommend someone consider an Advantage plan? Is it for some people?
If that's what they need. If financially, if that's what they want, then yes.
Is it a financial decision to go on C?
I would say so. It just depends on what your situation is. This year in the Houston area, of course we have MD Anderson, but Blue Cross dropped MD Anderson for their HMO network for their Medicare Advantage plan in November. Anybody that was going to MD Anderson having cancer treatment, they were dropped in November. Well, if they changed for an Advantage plan, it wouldn't start until January 1st. So they were without a month of having any kind of insurance needs. They were going to have to go and either pay out of their pocket or they had to change what facility they were using.
So your advice is if somebody is doing okay financially, they're not at the poverty level, they should not get.
They got to look at it and do what's best for them. I can't say you can't get it because that looks like I'm trying to sway you from one way to another. You got to best meet your needs.
But you're implying that you get better care not on an Advantage plan.
It depends on who your doctor is. You know, I would say, I would say.
So you might have a good doctor and they might be on an Advantage plan. Then it's a win.
If something happens and you pick an HMO, okay, and you need to go to a doctor in California and you're living in Texas, you can't do that. That HMO won't go from one state to another. But if you pick a PPO plan, you may be able to use a doctor outside your network, but your out of pocket, instead of it being $5,000, could be $12,000.
So if you travel a lot or you have kids out of state, you should probably not get an Advantage plan. That is safe.
I would say so. And if you're someone that's, sit down with your kids and let your kids know what's going on. Don't just try to always be in control. I mean, the elderly doesn't want their kids to help them with anything. You see that all the time, but
Sure.
you sit down with your kids because if you get sick, they're the ones that's going to help you.
All right.
Maybe they would have said, Mom, if you'd have told us, we could have all paid that Medicare supplement.
Yeah. So what is D?
D is your prescription drug plan. D is what Debbie was talking about a few minutes ago. I have a prescription drug plan. And I don't mention names when I'm talking because I just don't think it's right to mention company names. But I have a prescription drug plan. I pay $0 for mine. Okay, I pay a copay. I have an excellent prescription drug plan. But if I took more prescriptions, I could be paying for one whose prescriptions are $89. I mean, we have one in the Houston area that it's $89 with no deductible. And they're probably, I'd have to look at it. I know it's in California. I just don't know what the numbers are in California. I'd have to go to Medicare.gov. Everyone should open up a Medicare.gov account, and you can always go on there and look at everything and see what's going on with your prescriptions. See what's going to be the best plan for you for next year.
Is there a place to put in all your prescriptions and it will tell you which is best?
Yes.
And where's that at?
Medicare.gov.
Okay.
Medicare.gov. And that will tell you everything. You can look at all of your cost and everything for Medicare.
That just sounds too simple for a government website. Are you sure?
Actually, it's very good. I've gone on there a few times. If they are mailing something to you, they'll put their letters online. You can find them. If you need to reprint your Medicare card, I think you usually can find that there. And
I'll do that.
I found them really user-friendly, surprisingly so.
Is this the right time of the year to change plans, or no? You need to do a certain time?
You have to wait until October to change your prescription drug plan. That's where you start seeing all the advertising. All of a sudden, everything's just the greatest thing since sliced bread.
But if you're starting up for the first time, you can do it any time of the year. Is that right? But then thereafter, it's October?
If you're starting out for the first time, you've got your initial enrollment period. That's 3 months before you turn 65. The month you get on Medicare, and 3 months after.
Okay. So there's a little more flexibility the first time around.
Kind of, sort of. And then if you're someone leaving company insurance, there's a time that you can do that when you're leaving. You're coming off your employer benefits. That's a whole different ballgame. And a lot of employers are having their own Advantage plans with the employer benefits. So you want to make sure that, you want to look at your employer benefits. And if that's what you decide to stay with, you stay with your employer benefits, and then down the line, you need to go back to original Medicare and a Medicare supplement You can do that because employer benefits will have guaranteed issue. And a lot of people will not tell you that because they want to make that sale.
Yeah, my aunt was on an Advantage plan, but then when she applied for Medi-Cal, they told her she's got to go off of that and go on original Medicare. So we did that.
So can I double check? I wanted to go back to A and B. You're saying, I know you said that you can get C, which is a supplemental, but you're saying for a lot of people, A and B is simply the best plan. And although obviously it's got to be custom, everybody's different. Did I get that right?
A and B is original Medicare.
Mm-hmm.
When you look at your card, you got Part A and you got Part B. That's it. That's original Medicare. And then Part C is your Medicare Advantage plan. But you have to have A and B to get C.
So everybody has to have A and B. And then C and D are optional.
Correct. But if someone doesn't have B, then they can't get a Medicare Advantage plan. They can't get a Medicare supplement. Some people don't want to pay that premium. They say, oh, I'm never going to get sick. I'm not worried about it. Well, their penalty for getting Part B will be 10% for every year you could have had it, but you failed to do it. So if you wait 10 years, you're going to pay 100% more forever per month. And a lot of people don't know that because they don't, I'm not going to get sick. Well, what happens if you do get sick? Then you have to pay 100% out of your pocket.
You mean people can choose not to get B?
Yeah, if they don't enroll in it at the right time and the right way, yes. Like the gentleman who signed the card because he told the company he had company insurance, he had retirement benefits. They said sign the card and send it back in, and he delayed his Part B, went in the hospital and had a stent put in his heart, and it cost him $10,000. I knew the answer. That's how I got started. I took the Medicare New Handbook and put it in people terms. I saw a need. He got the wrong information from Social Security because he answered the question the wrong way. They didn't dig and say, are you sure you're on company insurance? You're not on retirement benefits? Then that's how everything got started. They're not going to dig into and ask. They can only ask you questions. They can't dig in and find out what the problem is.
You know, I think that's a really easy mistake to make, to confuse your Social Security with your Medicare. I do that often. I'll be wanting to do something for my Medicare and I'll go to the Social Security site or vice versa. It's easy, I guess, because they both can happen. Well, for us, it was 65.
Well, Medicare doesn't know how to enroll you in Medicare. We got to do a whole workshop on that. Medicare doesn't know how to enroll you in Medicare. Medicare doesn't do the enrolling. Social Security does all the enrolling in Medicare.
That's why it's confusing.
That's why. So why did they make that? All Medicare does is pay claims and help you find a prescription drug plan.
Wow.
Yeah.
And then for me, some of my my D plan, some of it it reduces what I get in Social Security, which is minimal because I lived out of country for 20 years and didn't put enough in here.
Now we've got 10 minutes more. Please go over what you think we need to that we haven't so far.
What we need to? I would say that people need to sit down and personalize their Medicare and make it meet their needs.
So they should go over their prescriptions, first of all, like I am going to.
They need to go over their prescriptions. And some people, like Debbie's got prescriptions that are real high. They're getting their prescriptions from Canada because some prescriptions aren't covered under Medicare at all. So they get them from Canada. I mean, there's a whole bunch of different things that you can do.
Now, pharmacies now have their own discount plans, which a few times has been cheaper than my insurance is covered.
Okay,
what's that all about?
Let's talk about that. So if you go and you say, you know what, I don't need to get a prescription drug plan. I'm using GoodRx, or I use Single Care, or I'm going to use Amazon's pharmacy. Those are not credible prescription drug coverages. And then you go back to get a Part D plan later on, because now you're taking a cancer med and you've got to have it filled by you want to have it filled by your prescription drug plan. You're going to get a penalty. It's going to go all the way back to the day your Part A started. And right now it's like 34 cents. I had one gentleman, his was $15 a month extra.
I have another question for you. Speaking of getting medications, I travel a lot, and sometimes I'll leave town for a month or 2 or even 3 months. And then I'm in trouble because some of my medications I have to get in the state I live in with my doctor with his license in California. So if I go to Hawaii, I'm out of luck. Can't get my meds. So I'm wondering if, is there any way of making sure you can, they always say, be prepared for an emergency, have an extra month's supply of your meds. Well, how do you do that? Any suggestions on that?
You'd have to talk to your doctor, because they've got certain rules where you can only get certain things. I mean, that's taken us out of the average person's situation.
Yeah.
Wouldn't you say?
Probably. Although a lot of us travel now.
Debbie, if you travel a lot, then you can't use your Advantage plan in another state, right?
Well,
Toni?
You can use your prescription. If it's an emergency, you can.
I'm not talking about prescription. I'm talking about Plan A or Plan B.
You can use if you're traveling and you have a Medicare Advantage plan and you slip and fall and break your leg, that's an emergency.
So that's an emergency.
But if you travel and maybe you've got to go do a doctor's appointment and you've got an HMO, you'd have to call that HMO and see if they would make a exception to the rule.
If you cut your finger and you go to an ER, that's an emergency, yes?
That's an emergency.
All right.
It all depends.
Did you know that, Debbie?
Yes, and I don't have Advantage plan. I just have A, B, and D. So I think with A and B, I can.
You don't have a Medicare supplement?
No, I just have A, B, and D.
Well, then we need to talk.
Well, I don't spend any money on it. It doesn't cost me anything.
Well,
so I'm happy.
If you're hospitalized for more than 21 days, it will cost you the 20% that Medicare does not pay after 21 days, right? That's why I got a bill for $8,000.
Okay, so we can use Debbie as an example. Can we use you as an example, Debbie?
Sure.
So if something happens and she has to have serious surgery, then she's going to have the $1,676 deductible for the inpatient hospital stay if she stays inpatient. But she's going to have to pay 20% of whatever that bill is with no stop loss. So what's 20% of $200,000? That's what she's going to have to pay.
What about the scenario for folks who are on Medi-Cal or Medicaid? Is that still the same issue?
But that's a whole different plan for the whole different situation with a whole different income level. If you can qualify for Medi-Cal, then get on Medi-Cal. Okay? If that's your situation, we'd have to sit down and look and see what you've got, where you're going. I mean, we kind of went, we didn't really get into caregivers, did we?
Well, I think this applies to
it does apply to
a lot of us.
Yeah. So we would have to look.
Caregivers are just normal people,
We would have to we'd have to look at Medi-Cal and see if you qualified for Medi-Cal, I'd get on it in a heartbeat. Because you may not qualify for a Medicare supplement due to all the prescriptions that you could possibly take. I mean, you got to answer health issues.
Now, I'm sure you've seen people applying for Medi-Cal, Medicaid, and they get denied because they didn't fill the paperwork out right. 3-4 times. Oh, now you made another mistake here. Some people will charge you $5,000 to do it, and they guarantee that it'll get done, and you don't have to worry about filling it out wrong. You don't have to worry about it being rejected. You recommend those consultants like that charge?
I would have to look and see what the person's individual situation is. I would go and try for here in
Is
Texas.
Is it really that easy to fill it out and do it properly?
Do what?
Is it that easy to fill out all the forms, do it properly, and not make any mistakes?
Hey, I live in Texas. We're the friendly state. I don't know how California is, but it's not
It's
that.
complicated.
It depends. You've got to have, it depends on what your income level is, you
That's
know?
the tricky part. Yes.
I mean, I haven't heard a lot of people that have had a hard time. Some people have tried to get, first, my mother was trying to get qualified. We are trying to get her qualified for VA benefits. She got denied. The next time we tried, she got accepted. So it all depends on what the situation is. You know,
Right.
I mean, everybody knows, some people know how to work the system. And it may be worth it. Get your kids to pay for it because they're going to pay for it one way or another. Wouldn't you say?
Yeah.
Yeah.
So are there caregiver issues that we didn't already cover, since most caregivers are normal people and we cover a lot of normal things that
Well,
people go
I
through?
can say that hospice, okay, here's
Yeah.
something I'm going to say about hospice. Don't wait until your family member is so sick you think they need hospice. If you
There's
feel that there's a need for hospice, you've got palliative care. I got that for my mother, and it was a blessing.
Yes,
Yeah.
I
And we
did
were
too.
able to get somebody to come to the house to check her out once or twice a week, and I didn't have to take her to the doctor. I
Mhm.
have a special needs sister, and my mother was developing dementia. So my plate was super full. Hospice is a blessing. Don't wait
Amen.
too long for hospice.
Good.
Well, except my understanding was that they have to assess that you are within 6 months, likely within 6 months of passing, in which case then but if you,
Well, then
That
they just put you on palliative care. I don't think there's a limit on that, right?
I don't. She made palliative care, and she was on palliative care for 2 years
Yeah, there's no limit.
before she ever passed away. So if your doctor approves you, you're pretty much there. The hospice company knows how to work it.
Yeah.
Depends on what hospice company you go with. So my mother was on it for over almost 2 years. It was the best thing I ever had. All I had to do was pick up the phone. The doctor came over. It didn't cost us a penny. She
Mhm.
was on an Advantage plan. When you get on an Advantage plan, when you're on an Advantage plan and you get on hospice, Part A picks up.
wow,
Never went to the doctor again. They
no.
always came to the house.
Yeah, hospice was a real blessing for my family as well. I highly encourage it.
Yeah. So Dave, we can do another talk. I've got a feeling we're going to see a lot of different changes with this next Medicare open enrollment.
Yeah.
It's going to be really big.
Tell us about your book, how they can get it, and
Well,
how they can get a hold of you, your
the
phone number.
books now and I've got the Social Security and the Medicare card. It's on my website, tonisays.com, tonisays.com. And they can go online, and I've got the book. I've got a video series that's got all the questions and answers that we did.
Wow.
And, we sit down and devise a plan for somebody to meet their needs and get your kids involved. That's all I can say. If you're a kid, make sure you know what your parents are doing. That's the big one. When
Good
you
point.
say,
Yeah,
yeah,
absolutely. My mother was on SCAN, which is an Advantage plan, and it was great. We never had a problem with that.
yeah. Advantage plans are not always bad. And when I get older, if my Medicare supplement goes up and the premiums are high, I may go with an Advantage plan down the road. We don't know what's going to happen in 10 years.
Yeah,
We have,
and you can pick a doctor. If you don't like him, pick another one.
that's
My mother
right.
found one she liked.
That's right.
All right.
Put the control on your side. Don't put your control on the insurance company's side.
Right. Well, I can't believe how fast an hour has gone.
Has it been an hour?
It's been an hour. I'm
It
surprisingly
has.
having fun. Um, Toni, how can listeners reach her? I already asked you that. It's tonisays.com, and the book is there. Your phone number's there. Anything they need to know is on Toni.
I'm Toni.
ToniSayS, like Simon says.
ToniSays.com.
All right. Debbie, how can people reach you, Mayor Debbie?
MayorDebbie.com, and you'll be able to find all my books there. They're also on Amazon. Integrity 101 series, Debbie Peterson.
And
see, I need to reach you, Debbie.
Well, I'd love to talk to you.
And I'm Caregiver Dave, and I'm on caregiverdave.com. And my number one best-selling book, It's Your Life Too, How to Thrive as a Caregiver, available wherever books are sold, and also on my free membership website, caregiverdave.com, where you can also schedule a free 30-minute initial coaching call. Wow, that's like very valuable. You talk about whatever you're struggling with, and also I invite you to join my Caregiver Dave Facebook community of 34,000 caregivers, lots of tools, resources, videos, this radio show, much, much more. And if you click the like or follow button, whatever platform you're watching or listening to this interview on, it helps us reach even more caregivers by improving Google's search engine algorithm. So thank you again to my
we need to do that. I've got a radio station that endorses me, so we can. You and I need to talk, Dave.
Let's talk. We'll have coffee talk.
Oh, okay. That'll be a long coffee because I'm in Texas and you're in California.
That's okay. We'll do it virtually.
Okay.
So thank you, all my listeners out there all over the world, tuning in every Wednesday, making us the number one caregiver podcast and radio show on the internet. So until next week, same time, same channel. May God richly bless you all. Thank you, guys.
Dave Nasani, the Caregiver's Caregiver, has just released his 6th book entitled It's My Life Too, Thrive to Stay Alive as a Caregiver. It was specifically written for caregivers who know they should be putting their needs first, but just don't know how. Dave is the sole caregiver to his wife, Charlene, since 1996. He knows firsthand what caregivers are going through because he is one. He now speaks all across the country, offering caregivers his amazing caregiver support package. Even the airlines tell us that in the event of an emergency, to put your oxygen mask on first before you help your child with their mask. They know that those who don't heed their advice often black out, thus becoming unable to help either themselves or their child. And caregivers are exactly the same way. It's My Life Too, Thrive and Stay Alive as a Caregiver will help caregivers who are neglecting their sleep, diet, and social life and learn to put their needs first. Pick up your copy today or buy one for your special caregiver, on sale everywhere and at caregiverdave.com.
Sometimes it feels like the sun will never rise, like the birds will never sing.